may not be all bad. An analysis of nearly 3 million people suggests that being moderately overweight does not automatically make a person at high risk of early death. So is it okay to have a few extra pounds?
Okay, well, you know, this is very controversial, and this study, which I did look at, is actually a meta-analysis or a review of the literature. So no individual cases were actually looked at. And that's really important because basically they're looking at all of this literature that they've been able to pull from. So there's always issues with data. But beyond that, they're looking at mortality, which is dying. They're not looking at morbidity, which means that you can live to be 100, but how healthy are you as you're living to be 100? There was no discrepancy whatsoever on obesity. Any BMI over 30 was coordinated or thought to be related to a higher chance of dying early. It was that span between 5 and 30
so
that was a question.
Are you saying it's not okay to be heavy?
It's basically at this point in time, the extra pounds may in the long run make you live longer in some certain populations, but it may not make you feel better. And the thing is too important is BMI versus weight. So go to your doctor and find out really what is your ideal weight by your BMI as versus just your weight itself.
Remember with this study, if you're a little bit overweight, you have a higher risk of developing diabetes, hypertension, obesity, all of these things that get you to the doctor. So they might be living longer because they're getting treatment for the problems that the obesity is causing.
All right, let's go on to number 2. Are mammograms and breast self-exams worth it? In 2009, of course, the U.S. Preventative Services Task Force said most women don't need mammograms until the age of 50. But a pair of studies released in April supported the idea that women in their 40s, especially minority women, should get annual mammograms.
I'm going to take this one, being an OBGYN and a husband that's a breast cancer surgeon. We need yearly mammograms after 40, no question. There was something about potentially stopping the breast self-exam because by the time you find something, it's way past when you should have done something about it. But I disagree with that. I think women should be in tune with their bodies and doing monthly breast exams so that when they do notice a change, they're able to get in a little bit sooner.
What about the study that said for people who found something and then they went in, they were invasive, and they did more harm than good?
It doesn't really do more harm than good. What it's doing is increasing cost and having more procedures performed. But the truth of the matter is there's a lot of times when I wouldn't think it's something serious and it ends up being serious. So I say
err on the side
of caution.
All right, number 3, is your multivitamin killing you? Mom may have told you to take your vitamins, but a study published in October found that older women who took multivitamins and other dietary supplements such as iron and folic acid, and vitamin B and zinc actually had a higher risk of dying.
Again, this is something you have to look at these studies quite carefully. Multivitamins aren't bad for you, but again, in context of how much you take. Taking a multivitamin in a proper diet is okay, but if you use a multivitamin to replace a proper diet, or if you do what a lot of patients do, a little bit's good, a lot must be great. Taking 20 multivitamins a day isn't good for you, so it's all about having common sense and understanding that a real good diet will always supplement a multivitamin.
Is that toxic if you're taking too much of a good thing?
Well, yes, it can be because there are 4 vitamins, vitamin A, D, E, and K, ADEC. You can remember it that way. They're fat soluble. You're not just going to urinate out excess. It's going to stay in your body. Those are the ones you truly have to worry about taking excess. However, we all believe in moderation, and I think generally speaking that will always be good for you.
All right. My parents always said get your vitamins from your food.
That's
exactly.
right.
Healthy diet and exercise.
Easier said than done, but it is possible. All right. High salt diets might kill you, but low-salt diets might too. What? We've always been told that too much sodium raises your blood pressure, but a report published in May found that death from cardiovascular problems was 56% higher for men who ate the least amount of sodium. What?
Well, part of the expression, but this study should be taken with a grain of salt.
Okay.
The thing is, the fact of the matter is, anything in excess or a deletion of anything could cause problems. So to say that not eating enough salt can cause more problems than eating too much salt is ridiculous. If you have a high history of blood pressure, obesity, smoking, any of those cardiovascular risk factors, taking too much salt can be bad. If you do not take salt in your diet, which is a staple of the human diet, you must have salt to exist.
Right.
Cutting it out is going to be problematic as well.
I have a personal question I'd like to ask all of you. I have absolutely terribly low blood pressure. And that, people laugh and say, oh, poor you. But it is an issue. When I get up, I feel like I'm going to fall down.
Yeah, people who have that issues, usually we tell them to wear support stockings. Or
goody.
And yourself, if you've been ruled out for other causes, we will say take a little more salt in your diet. There is a way to do that, but it has
So bring on the chips?
Well, not the fats.
I know, absolutely. And I have this problem myself. I'm usually 80 over 60. And I get dizzy a lot. Yeah. I do. But you have to be very careful. Get up slowly and drink and get your fluids.
Okay. Drink what?
Water.
Okay.
Keep from being dehydrated.
Thank you, doctors.
Every now and then a little alcohol.
Okay. She said it was okay. Lindsay, over to you.
Thanks, Cindy, and thank you, doctors. Okay, DVD lovers, this week's Star Watch's Sam Hallenbeck has one DVD for the kid and then